Hello, I'm Dr. Anderson. Thank you for being here. I know there's a certain amount of anxiety or possibly even fear in coming in today, but I assure you, my entire team and I will do everything we can to make your visit as comfortable and as safe as possible. Over the next few minutes, I would like to share some very important things about your upcoming treatment, so please use this opportunity to learn as much as you can about your options and your expectations. Welcome to Granger Oral Surgery and Dental Implants. Nearly 10% of people have a tongue or lip tie, often without even knowing it. A tongue or lip tie, technically called a prominent frenum or frenulum, is easily treated with a simple procedure called a frenectomy. During weeks 6 through 8 of development, a baby's mouth begins to form. This happens by cells going away to form the oral cavity. Sometimes the cells under the tongue or the lips don't go away completely. This tongue or lip tie limits normal movement of the tongue or lips and is called a frenum or frenulum. It usually affects both the lip and the tongue. Being tongue and lip tied can cause several problems. The earliest problem is painful and ineffective breastfeeding. When the lip doesn't fully lift due to a frenal attachment, the latch is ineffective, causing difficulty both for the baby and the mother. Tongue movement is critical in drawing out the milk. When there's limited tongue movement due to a tongue tie, a baby has to work much harder and longer at each feeding and is still unable to get enough milk. This can lead to a very fussy baby and poor weight gain. As a child grows, tongue and lip ties can affect speech and dental development. If the tongue is tied, it doesn't rest normally touching the roof of the mouth. This can lead to underdeveloped jaw structures and a higher chance of needing braces and having breathing problems. Performing early frenectomy can easily prevent these problems. Using a laser, I simply release the tie until the lip and tongue are able to move freely and normally. Infants do best without any anesthetic, so they can feed immediately without a numb mouth and tongue. Older patients require some numbing medicine for the procedure. During normal healing, the area will look white and gray and can appear concerning. Don't worry, this is normal. For the first 5 to 7 days, stretching exercises are important for the best possible outcome. For infants, use a clean finger to lift the lip and tongue and gently massage the area where the attachment was. This should be done before every feeding for 1 to 2 weeks. Pay attention to the latch to make sure the upper lip is flipped out. Retraining the baby's latch is very important. For older patients, similar stretching is important, and there are a few exercises we will review with you, depending on the patient's age. The risks of a frenectomy are extremely low. There's a very small chance that the site will scar, requiring retreatment. Stretching exercises are the best way to prevent this. It is also very rare to have prolonged bleeding, infection, or damage to nearby structures. My family and I have personally experienced the incredible benefit of early frenectomy with our own children. My wife, as a family doctor, has many patients, babies and breastfeeding mothers, who have had incredible improvement from tongue and lip tie release. I have already discussed some of the more common expectations and risks of performing your surgery. Please review the informed consent form. It has some information about your planned procedure, and be sure to ask any questions you may have before signing. Please, if you have any questions or concerns at all, at any time, ask us. Our whole team is dedicated to your comfort and safety. We want you to know that you are valued, and we will do everything that we can to make this as comfortable and easy for you as possible. Thank you again, and welcome to Granger Oral Surgery and Dental Implants.